Its rate of infection is unprecedented, as this outbreak of Ebola in the Democratic Republic of Congo spreads and kills people faster than any other outbreak of the disease in history. Children are being disproportionately affected. They make up a quarter of confirmed cases and almost a third of all deaths.
They're not the biggest group to be infected, but what we are seeing is when they are infected, they have a much greater chance of not surviving. And particularly that's for children under 5. So we need to avoid children getting infected.
There's also been a surge in indirect deaths. As medical resources are focused on the epidemic, routine health services, such as childhood measles vaccinations, have been disrupted. A problem compounded by the defunding of foreign aid by the US government, among others. At its current rate, this Ebola outbreak is on track to surpass the 11,000 deaths seen in the 2014 to 2016 epidemic in West Africa. Across the DRC, the case fatality rate is nearly 50%, going up to 70% in places where response efforts are most challenging, such as in North Kivu province. Insecurity, displacement, and mistrust of health workers are also fueling the spread. On Sunday, ambulances were attacked in the eastern city of Bunia. The World Health Organization said it was far from an isolated incident.
Almost on a daily basis, we face some kind of reaction, from the communities. And again, these are difficult situations. People are having their relatives who are sick, who are dying.
Another challenge is the lack of approved vaccines or treatments for the Bundi-Bujo strain of Ebola behind the current surge, although clinical trials are underway.